Sometimes one faces redness of the eye, irritation, watering, and a gritty feeling as if some sand particle has fallen in the eye. Many times this is due to a condition called as blepharitis. Let us see what this blepharitis is.
When performing an eyelid scrub, start by washing your hands with soap and warm water. Then, place small amount of shampoo in the palm of your hand. Make sure to use a baby shampoo because it will not irritate your eyes. Now, run some warm water into your hand. Finally, mix the shampoo and water together with a clean cotton swab. When ready, pull down your lower eyelid and use the cotton swab to rub the solution back and forth on the eyelid margin. Make sure to use a fresh cotton swab for each eye. Follow up with the cool water rinse of the area. Repeat this process for the alternate eye. Healthy tears consist of a precise mixture of oil, water, and mucus. Meibomian gland dysfunction, also called MGD, is a condition where the meibomian glands do not produce the proper quality or quantity of oil in the outer layer of the tear film. In normal tears, the layer of oil produced by the meibomian gland seals the tear film and helps prevent tears from evaporating too quickly. In MGD, the glands become blocked and do not produce normal oil due to inflammation. Inflammation can be related to problems of the lid, contact lenses, hormones, or even incomplete or infrequent blinking. When the glands do not produce enough quality oil, tears evaporate more quickly than normal, resulting in dry eye syndrome. MGD is the leading cause of dry eye. While MGD is not generally sight-threatening, it can have a negative impact on quality of life if left untreated. Symptoms of MGD can include dryness, scratchiness, or burning sensation, and even problems with visual acuity. MGD can also lead to chalazion and infections of the lid margins, which can be painful and unsightly for patients. Lastly, for patients who wear contact lenses, MGD can make wearing lenses very difficult. MGD does not usually go away on its own and requires treatment and follow-up examinations by an eye care professional. Blepharitis, the common eye disease in the world, and until recently the most undertreated disease in the world. Blepharitis is the precursor of most lid diseases such as dry eye disease, contact lens, intolerance, and meibomian gland dysfunction, also known as MGD. Now let's go back and look at those eyelids again. Blepharitis is an overgrowth of the otherwise normal bacteria living along the margins of eyelids and the eyelashes. This is the only place in the body that never gets washed your entire life. So over time, these bacteria build up and forms a biofilm like the plaque that forms in your teeth. This toxic environment makes for a perfect food source for a nasty little mite called Demodex. It makes irritation and inflammation of the eyelids even worse. These biofilm bacteria begin to produce substances called exotoxins. These exotoxins cause the tear gland within the eyelid margin to become inflamed, which degrades the quality and quantity of the tear, leading to malfunction of meibomian gland and aqueous tear glands, the glands most responsible for good tear production. Symptoms of blepharitis ranges from mild to severe and include foreign body sensation, irritated watery eyes, itching, crusting, eyes stuck together in the morning, grittiness, and the need to constantly rub your eyes. As the vicious cycle continues, the disease slowly progresses, eventually leading to dry eye syndrome. Historically, the only treatment for blepharitis is scrubbing your eyelids at home with baby shampoo or other products. This treatment has never proved very effective, nor has been accepted well by the patient, because only scrubbing does not remove the biofilm. Prescription eye drops are usually ineffective since they also did not remove the biofilm, and they can be very expensive, which leaves only one temporary solution available: lots of artificial tears. This is not a good solution to the problem. Now, eye doctors have a way to break the vicious cycle of blepharitis and bring relief to millions of patients who suffer daily from this disease. Introducing Blefex, a revolution in the treatment of blepharitis and dry eye. The biofilm is full of exotoxins that has been building up for years, is now safely and effectively eliminated, removing the source of inflammation as well as the food source for Demodex. The procedure takes just few minutes and is well tolerated. Most patients report improvements in symptoms almost immediately, and many begin to make more of their own tears again. Blefex needs to be repeated regular intervals to keep the disease from returning, much like going to the dentist to get a teeth cleaning. By keeping your eyelids in optimal health, you should be able to keep free of blepharitis and keep your tear glands healthy and active for the rest of your life. Blefex is not covered by insurance, but you will find a procedure to be very affordable. There are numerous eye-related conditions that can cause discomfort. Your eye care professional may have you perform a warm soak of your eyelids using a compress to help alleviate symptoms associated with a particular condition. By washing your hands with soap and water. Then, moisten a clean washcloth with warm water. While closing your eyes, place the warm washcloth over your eyelids for about 5 minutes. Repeat this process using a fresh washcloth several times daily, as recommended by your eye care professional or as needed to resolve your symptoms. Cleradex is a safe and effective way to eradicate Demodex mites. Infestations of Demodex mites frequently occur in the eyelash follicles, leading to severe common ocular conditions, and soap and water is not enough to wash them away. Cleradex is derived from the key component in tea tree oil called 4-terpineol. It provides all the Demodex-fighting benefits of tea tree oil without any of the potentially irritating side effects. This patented all-natural preservative-free formulation is applied once or twice daily. Cleradex effectively cleans and soothes the skin around the eyes, the nose, and the face. And the 4-terpineol in Cleradex eradicates the mites and bacteria, which leads to symptoms associated with blepharitis, dry, itchy eyes, styes, and rosacea. Unlike other tea tree oil products, Cleradex is non-irritating and safe for everyday use. Depending on the severity of your symptoms, your doctor may also recommend an in-office solution called Cleradex Complete to supplement your at-home Cleradex treatments. Cleradex is a safe and effective way to eradicate Demodex mites, not just the symptoms they cause.